Well, the meeting today is focused on uro-oncology and specifically for the region of Central Europe. As you know, the Central European Urologic Society has been the host of this meeting, and we're focusing on how prostate cancer care, as well as bladder cancer and kidney cancer care, is evolving over the years, not only in systemic area, in advanced multimodal therapy, but also in the early stages. Are we having a shift there of over-treating patients? Should we have more minimal invasive therapeutic modalities? All those questions will be addressed today in this meeting.
This meeting, although it's necessary to depict the previous one, will clearly depict that creating the new platform and discussing about the controversial urology and urology concerning the bladder, the kidney, the prostate cancer are crucial not only to find the new young talents, but also to create systematic position of the current knowledge.
I'm very surprised like this meeting is comfortable for everybody because the topics are concentrated for oncourology, so we can find all answers of oncourology of prostate cancer, kidney cancer, bladder cancer, so I prefer such meetings.
The topic that I addressed was HIFU, high-intensity focused ultrasound for the treatment of localized prostate cancer. It is a very trendy topic at this point. HIFU has become like the first option deployed for focal therapy, and this is a subject that is really picking up in urological cancer arena.
My topic was to talk about the PUT trial, which is a trial on upper tract urothelial carcinoma, treating about adjuvant chemotherapy after surgery in order to improve the outcomes of the patients.
Well, first of all, I talk about the Carmina and the Showtime trials, which have been published last year and will probably are changing the medical treatment option in metastatic renal cell carcinoma with the question if we should first do cytoreductive nephrectomy. And probably the results of these two trials clearly demonstrate that the systemic treatment upfront before we perform cytoreductive nephrectomy in metastatic renal cell carcinoma patients is like a litmus test to select patients who will really benefit from the immediate treatment and then followed by a cytoreductive approach.
I was chairing the session about the bladder cancer, and we spoke mainly in the first part of the session. We spoke about the treatment of BCG refractory bladder cancer, which is a very difficult topic and difficult patients because they are in danger of disease progression. So we discussed how aggressive we need to be in the treatment. And in another part of the session we spoke about muscle invasive tumors, about the role of new treatments, which are immunotherapy and some targeted therapies and so on.
My topic is how much the data is accumulating in for and against about local treatment for metastatic prostate cancer. So although the gold standard treatment of metastatic prostate cancer, even for oligometastatic, this is the LHRH agonist, so the ADT therapy, the data is accumulating, and then there is a hope, especially from the surgical point of view, that probably local treatment might help in overall survival and cancer-free survival as well.
There is no any doubt that strongly motivation of all the staff from University of Vienna to preparing the meeting, full support of neighborhood societies like, for example, Slovak Urological Society, Czech Urological Society, Hungarian and Polish Urological Society are very, very strongly motivated to cooperate not only with the University of Vienna but also with the team of Professor Shahrokh Shariat.